They're quite similar to women in the sense that we are going to start by doing the extra fat marking. So we're going to mark where is the extra fat that I want to remove. Maybe a little bit here, a little bit here, a little bit here. Usually in the male patient, most of the fat is concentrated right here. Lower abdomen, the flanks. Usually this fat pad that is very annoying in men, and the gynecomastic tissue. So usually around here. So usually in men what we want is to reduce the lower torso. So we're going to remove most of the fat right here in the flanks. Remove upper torso, but the whole idea is to create the V. So we're going to remove the extra fat, but we're not going to literally try to change the frame here. The whole idea is to create the V shape right here. The extra fat sometimes right here. He doesn't have much, but usually men tend to have a little bit of fat pad right here. They don't store also a lot of fat here, sometimes a little bit here in this area. Usually when we have a man that is like literally in the structure more gynecoid, they tend to have more similarities like on the markings in females. So they tend to have more fat right here, more fat right here in the hips, midline. And usually, as I was telling you, the whole idea is to do the imaginary line between the two. Usually the midline in men ends right there, between this area right there, because this is the arcuate line right there in men. We're going to lift a little bit the pectoralis muscle. We lift the arm, we actually see where the muscle is, by tension. And we're going to follow here the insertion. Remember that the lower border of pectoralis is a hard edge. That means that it's not going to move because it's actually inserted into the bone, into the rib cage. We're going to follow the shape of the muscle right here. Some men can have a very straight line. Some of them, might be more like a curved line. In him, it's actually quite straight. And now we're going to follow also the rib cage. So we're going to palpate the rib cage right here in the lateral border of the rectus. So in these two dots, we're going to mark right here. This is literally T10. So this is our rib cage. It doesn't matter how asymmetric it looks, you just follow the real anatomy. Now from there, we're going to palpate where the lateral border of the rectus is, right here and right here. And we're going to try to see where the descriptions are, where the insertion of the muscle, specifically in the upper border, is. Ahora se contrae. We're going to ask contraction. For instance, on him, actually is a little bit curvy right here. You just start following the upper insertion right here. As we mark the lateral border, we're going to follow the lateral border right here as well. So in men, it's more easy to palpate, and in some sense also creates a little bit of curviness right here. Why? Because it's the bulkiness of the rectus abdominis versus the bulkiness of the obliques that are trying to, usually they do indentations here into the muscle, and they try to create curvatures here into the rectus abdominal inscription. So we're going to palpate. Once we have here, remember that this is T10, right? We're going to follow and try to actually palpate where is the first inscription. Usually the first inscription is right here, or a centimeter vowel below, but it's very close to it. So in him is a little bit below, but very close. Very symmetric. Some of men can have asymmetric. In him is quite symmetric. We're going to follow from here up. We're going to see where the borders of the muscles are. And we're right there. What are we going to mark now? Pectoralis, rectus abdominis. We're going to mark where the obliques are. In him, it's very easy to palpate, even to see them. You can see the line here, even above the area of the lateral flank. We're going to follow here the line. So remember that these are literally in a fan direction right here. So it's something like this that is going to create in the final drawing. So the whole idea is that we need to know specifically how much of the fat I'm going to resect right here in the pectoralis. Usually it's very easy. I just drew a line right here between the pectoralis in line and the anterior axillary fold. So right here, anterior insertion of the pectoralis and this area. Why is important here? Below this triangle here, all this triangle, we're going to resect as much as we can. We're going to do a hard edge right here, and we're going to fade it on the way up. Why is this important? Because all the way up to this level, we're not going to do a lot of liposuction. The whole idea is to create a fading appearance right here, all the way down to the hard edge that I want. That actually lead us to the area that we want to do the fat grafting. So in men, what we want is to create this, this area right here. Usually more in the central portion. Usually this is the area that most men struggle to improve. So we're going to do most of the fat grafting right there. And we're going to see where the negative spaces are. So we're going to create a negative space right here. Delta pectoral sulcus right here. The midline, all the way down to umbilicus. So we're going to create an indentation here. We're going to create literally like a canal right here. So it's very hard right here, and we're going to create a wedge right here all the way down. Right here between the pectoralis and the lateral border rectus abdominis muscle right here. We have here the depressions here of the sacrum that literally end right here. The midline is the same rhomboid shaped area that what we described in the female. But we're going to lift the arm a little bit here. So when he does this movement, we can see the indentations right here of the muscle on the scapular border. This is scapular border, and we can see very easily right here where the trapezius is. We actually can pinpoint where the muscle is right here. Cervical, thoracic portion of the trapezius muscle. Below here, arms down. Remember, we actually already marked here the latissimus dorsi muscle. So from here, we're going to mark here very easily, and him is actually visible here, the anterior, the superior borders right here of the muscle. And here is usually the costal margin right here. So from there we have mainly the muscle that we're going to show. And here in the arm, we're going to follow here the indentation of the pectoral, of the deltoid here in the thorax right here and right here. And this is mainly the area that we're going to do as negative spaces. So we're going to do a negative space here below the trapezius muscle. Here in the intertrapezius rhomboid area. This is the insertion right here of deltoid. And here, the area of the erector spinae muscle. We have our iliac crest right there. So we have almost the same concept as in female. The whole idea that this is the costal margin here, from here all the way down. This is what we call the green zone. All the way up to here. In here, what we are going to do is the same thing as in female. We're going to create a plane here. But mainly what we want here is to remove most of the fat here. But we don't want to change the shape. We want the V shape to be respected. We're going to feel where the trochanteric depression is, right here. We're going to follow here the shape of the gluteus maximus muscle. And we are going to try to do more like a square shape right here. So the whole idea, in terms of fat grafting and liposuction, is that we are going to try to remove all the fat here as well. So the whole idea is right here is that we are going to do intramuscular fat grafting in this area. In terms of the fat grafting, the whole idea in men is to do something like this. The whole idea is to create something that actually has like a lateral horn here, and do fat grafting here subcutaneous. And when we contract the biceps, we're going to follow here also the shape of the deltoid. As we have this position, I'm going to ask him to contract the biceps as well. Contract el biceps. And we have here the bicipital groove right here. So it creates like a triangle shape area right here. And as we do this, we actually create contraction of the triceps. So we did my intertricipital groove right here. And we're going to follow the shape of the triceps in contraction. And between these two, we have something that we call the transition zone. This is a transition zone between deltoid in contraction, triceps in contraction. He's going to contract the biceps. We're going to do this, the shape of the biceps.